Tetanus is a serious illness. It affects the muscles and nerves. It's also called lockjaw. Tetanus can be fatal if not treated. Tetanus is caused by a bacteria. The bacteria are called Clostridium tetani. These bacteria are commonly found in soil, dust, and manure. Tetanus is not contagious. It doesn't spread from person to person. If you have a wound and it gets contaminated with these bacteria, you can get tetanus. It's important to seek medical attention if you think you might have tetanus. Clostridium tetani bacteria produce a toxin. This toxin causes severe muscle spasms. These spasms can be strong enough to break bones. The bacteria usually enter the body through a wound. This could be a cut, puncture, or burn. Even a small scratch can be enough. Once the bacteria are inside the body, they multiply and produce the toxin. The toxin then travels to the nervous system. It's important to keep wounds clean to prevent tetanus. Visit a doctor for any deep or dirty wounds. Tetanus symptoms usually appear within 14 days of infection. One of the early signs is muscle stiffness. This often starts in the jaw muscles. Other symptoms include stiff neck, difficulty swallowing, muscle spasms, fever, and sweating. If you experience these symptoms, seek medical help immediately. Early diagnosis and treatment are crucial. Prevention is the best way to deal with tetanus. Vaccination is extremely effective in preventing tetanus. The tetanus vaccine is usually given as part of the DT-TAP vaccine. This vaccine protects against diphtheria, tetanus, and pertussis. Adults should receive a tetanus booster shot every 10 years. If you get a wound and are unsure about your vaccination status, consult your doctor. With proper wound care and vaccination, the risk of contracting tetanus is significantly reduced. Stay safe and healthy.